Okay, so good evening. For today, I'm going to discuss chapter 15, and our topic is about the respiratory system. This session will focus more on respiratory physiology, and we will no longer include here those topics that was discussed in the laboratory, and that is respiratory anatomy. So therefore, no, we will be skipping these structures of the respiratory tract, yung upper and lower respiratory tract, because that was discussed in the laboratory. So all of these structures included in the respiratory tract, from the nasal cavity to the lungs, including the nasal cavity, the larynx, yan, and the trachea and the bronchi, and also the structures of the lungs. We will no longer discuss that, no, because that is included in the laboratory. So you take note of the branches of the tracheobronchial tree, from the trachea down to the main bronchus, down to the lobar bronchus or the secondary bronchus, and then to your segmental bronchus, okay, or to your tertiary bronchus. And then you have your bronchioles, no, your terminal and respiratory bronchioles until makarating ka dun sa smallest unit, the most distal unit of the respiratory tract, which is your alveolus. Okay? So, yan, dito na tayo mag-start. No? So, as I have said, no, again, you take note of the branches of the bronchial tree or the tracheobronchial tree, from the trachea down to its smallest branches until you reach the alveolus. Okay? Sisimulan natin ang discussion at the level of the bronchiole. We will try to differentiate your bronchioles from the bronchi. Why is it that at this level, it is called bronchus? O, tingnan nyo, main bronchus, lobar bronchus, segmental bronchus. But when it comes to the more distal aspects of the respiratory tract, no? Okay, as you are going near each of those alveolus, no? Those branches are now called bronchioles. Ayun na nga yun, no? Yung terminal bronchiole and respiratory bronchioles. So what is the difference between a bronchus and a bronchiole? Bakit dito sa taas yung malalaki ang tawag bronchus, bronchus, bronchus? Pagdating dito sa baba, you have the terminal and respiratory bronchiole. What is the difference? No? Ito. From the trachea down to your segmental bronchus, it is made up mainly of hyaline cartilage. Its main framework is hyaline cartilage. So therefore, no, it is non-collapsible. Kasi di ba matigas yung hyaline cartilage, no? It is important, no, so that our trachea and the bronchi do not collapse, no, as we inhale and exhale, no, as the air moves into and out of those passages, okay, our airway do not collapse, okay, because it is made up of hyaline cartilage. But at the level of the bronchioles, as you can see, no, between the terminal and the respiratory bronchioles, it is made up primarily of connective tissues and smooth muscles. So, itong colored part na yan, no, na parang kulay brown ba yan? These are the smooth muscles, as you can see in the label. Connective tissues and smooth muscles. So therefore, no, at that level of the respiratory passages, no cartilage, no, is present. So therefore, this is already collapsible, no? At our airway or respiratory passage at the level of the bronchioles, it is already collapsible. And since it is also made up of smooth muscles, therefore, when smooth muscles contract, pwedeng magkaroon ng broncho bronchoconstriction. Oh, ano yung sinasabing bronchoconstriction? Okay. So, when the smooth muscles are relaxed, oh, kita nyo, kanina doon sa picture, when the smooth muscles are relaxed, the airways are widened. But when the smooth muscles contract, yun yung sinasabing bronchoconstriction, wherein the airway becomes narrow. No, when does it happen? Yung bronchoconstriction, severe bronchoconstriction, happens when there is severe asthma attack. O, yung may mga asthma dyan, if you have severe asthma attack, and also for those patients who have chronic obstructive pulmonary diseases, the airways or the smooth muscles of the bronchioles becomes very, very sensitive. No? Oh, halimbawa, yung mga asthmatic, they naka-inhale ng animal dander, naka-inhale ng dust, naka-inhale ng smoke. Because of the sensitivity of the airway, the tendency is for the smooth muscles to contract, resulting to bronchoconstriction. And look at how the airway becomes very, very narrow. Kaya pagka nagkakaroon ng asthma attack, makita nyo, maririnig nyo yung hininga ng pasyente. Diba? Parang mayroong wheezing, wheezing sound, or yung pumipito. And aside from contraction of the smooth muscles during bronchoconstriction, during an asthma attack and also during an exacerbation of chronic obstructive pulmonary disease, there is also severe swelling of the airway wall itself. So as you can see, during bronchoconstriction, mas kumakapal din yung airway. Again, that results to a narrower airway during bronchoconstriction. So that is the difference between a bronchiole and a bronchus. Bronchus is not capable of bronchoconstriction. It always remains open because it is made up of hyaline cartilage. So matigas siya, it gives framework to the bronchus. But at the level of the bronchiole, pwede nang magkaroon ng bronchoconstriction since it is made up of connective tissues and smooth muscles. And besides, it is also collapsible. Now, what is the difference between the terminal bronchiole and respiratory bronchioles? Ano pagkakaiba? Okay. The difference is that at the level of the respiratory bronchioles, hanggang sa baba, there is already gas exchange taking place. Meaning the air that is present at this level, sa level ng respiratory bronchiole, down to the alveolus, all of it already participates in the gas exchange in our pulmonary capillaries. So here are our pulmonary capillaries. May nangyayari ng gas exchange yan. Because from the nasal cavity down to the terminal bronchiole, no gas exchange is taking place. It is just merely a conducting zone or conducting pathway for air. Daanan lang ng hangin yan. Walang gas exchange na nangyayari dyan. Gas exchange takes place at the level, again, of respiratory bronchioles down to the alveolus. Okay, so let us continue. So, when you reach, once the air reaches the terminal part of the respiratory tract, ano ba yung pinaka-last part ng respiratory tract? Ito ngayon, the last part of the respiratory tract is the individual alveoli. And as you can see, each of those alveolus are surrounded by pulmonary capillaries. Okay, kasi nga, ang main purpose nun is for gas exchange to take place in there. Now, when you get a cross-section, kunyari, hahatiin mo yan, a section of each of those alveolus, what will you find? Ito ngayon ang itsura niya. An enlarged view of each of those alveolus, you will be able to see its coronal section. So, etong loob na to, this is the cavity of each of those alveolus, while this one are the sections, cut pulmonary capillaries. O, kaya makita nyo anong nasa loob ng pulmonary capillaries. Our blood, no? Our red blood cells. Okay? So, pagpasok ng hangin dyan, pagpasok ng air dyan, no? Inhaled air, okay, gas exchange takes place in this membrane. Itong membrane na to. Wherein, when we enlarge this membrane, itong small rectangular structure na yan, ito yung itsura ng respiratory membrane. This membrane, is a thin membrane where oxygen, and carbon dioxide diffuses in the opposite direction. Kaya nga tinawag na gas exchange kasi nagpapalit sila ng pwesto. The oxygen that we have inhaled, the oxygen present in the air that we have inhaled will diffuse from the alveolus going into our red blood cells. While yung carbon dioxide from our blood, particularly from our red blood cells, will diffuse from the red blood cells going to the alveolus. Nagpalit sila. Saan nangyari yung diffusion? Again, across the respiratory membrane of the lungs. So take note of these two arrows because, again, it represents the direction of oxygen diffusion, yung kulay red, and yung kulay blue represents the direction of carbon dioxide diffusion. So what are the layers of the respiratory membrane? Ano yung mga layers ng respiratory membrane where gas exchange is taking place? Okay. So let us enlarge this. Ayan. So ano yung mga dadaanan ng oxygen, as it diffuses from the alveolar cavity down to the pulmonary capillaries. The first layer, as you can see in the label, itong pinakamalinaw na kulay blue na to, is alveolar fluid because inside our alveolus, it is lined with a very thin layer of fluid. And that fluid is combined with an important chemical that we call surfactant. What is the main purpose of that surfactant? Surfactant decreases the surface tension of the alveolus. Yung alveolus kasi natin, meron niyang surface tension. Okay? It's like a balloon. Ang ating alveolus, parang rubber balloon yan. You know what a rubber balloon is. Yung mga lobo. Di ba? It's made up of rubber na, di ba? When you inflate it with air, it has a surface tension that has this tendency to always collapse. Kaya di ba pagka ang balloon, tinanggal mo yung tali, kusang lalabas yung hangin. Because of the surface tension of the balloon. Biglang lalabas yung hangin hanggang mag-collapse yung balloon. Okay? Di ba? Sa lungs natin, our alveolus, each of our alveolus, do not collapse spontaneously because of the surfactant present in our alveolar fluids. Okay? Yung surfactant decreases the surface tension of the alveolus. So therefore, our lungs do not collapse. Okay? Then the next layer is your alveolar epithelium. It is the main wall of our alveolus, which is made up of simple squamous epithelium. So if you will go back to your tissues, yung isang topic natin sa prelim, di ba sabi natin that the lungs, the air sacs of the lungs are made up of simple squamous epithelium. Ito na yun, the alveolar epithelium, the simple squamous epithelium. And we very well know that if there is a layer of epithelial cells, at the bottom of it will always be a basement membrane. That is why next to the alveolar epithelium, it is attached to the basement membrane, the basement membrane of the alveolar epithelium. Okay? So those are the layers of the respiratory membrane, no, on the side of the alveolus. Sa side ng alveolus, meron kang tatlo. Alveolar fluid with surfactant, alveolar epithelium, and the basement membrane of the alveolar epithelium. While on the side of the pulmonary capillaries, you only have two layers. No? What are those two layers? Your capillary endothelium. O, ito yun. Ito yung capillary endothelium, which is also made up of simple squamous epithelium. Simple squamous epithelium din yan. So therefore, if it is an epithelium, there should also be a basement membrane. That is why, sa ilalim niyang epithelium na yan, meron ka pa, yung kulay red na to, na mas matingkad. That's the basement membrane of the capillary endothelium. So nakailang layers na tayo? 5, di ba? 3 layers on the side of the alveolus. Again, alveolar fluid with surfactant, alveolar epithelium, and the basement membrane of the alveolar epithelium. Then you have 2 layers on the side of the pulmonary capillaries. Di ba? You have the capillary endothelium and the basement membrane of the capillary endothelium. Now, ano yung pang-anim na layer? Yung interstitial space. Yung kulay white. The interstitial space is located between the basement membranes, no, of the alveolar epithelium and capillary endothelium respectively. Yun yung nasa gitna, yung basement membrane. Okay? Now, so remember those layers, no, of the respiratory membrane. Now, the ability, no, of the gases to diffuse across that membrane, no, syempre, one of the important factors that affect that is the thickness of the membrane. Syempre, kailangan manipis lang yung membrane yan in order for these two gases to easily diffuse. Now, in cases of fluid accumulation in the interstitial space, pagka kasi ang baga, nagkakatubig, di ba? Mayroong ganong sinasabi ang mga doktor. If the patient has severe pneumonia, for example, there is this tendency for fluid to accumulate in the interstitial space. So, ang tawag doon, pulmonary edema. Naiipon yung tubig sa interstitial space. In cases of pulmonary edema, syempre pag tinubig yan, magiging mas makapal ngayon ang iyong respiratory membrane. And therefore, the diffusion of these two gases, the gas exchange of these two gases will be significantly affected. Kaya ang tendency ng pasyente parang nahihirapang huminga o parang nalulunod. Kasi talagang kinakapos sa oxygen because of the failure of gas exchange here in the respiratory membrane. So remember the 6 layers of the respiratory membrane. And remember the order of that respiratory membrane through which oxygen will pass through. And also the order of that through which carbon dioxide will pass through. Okay, let us continue. Okay, now, yan. So, after the respiratory membrane, let us discuss the process of ventilation. When we say ventilation, it is the process of the movement of air into and out of the lungs as we breathe. Habang humihinga tayo, pag yung pagpasok at saka yung paglabas ng hangin, that is called ventilation. And ventilation has mainly 2 phases. Di ba? That is inspiration and expiration. Again, inspiration is when we inhale, expiration is when we exhale. Okay? Now, ventilation involves the use of the principal muscles for respiration. Oh, what are those principal muscles for respiration? Oh, unahin muna natin. Oh, the principal muscles for respiration are primarily those that we use for inspiration. Again, the principal muscles for respiration are those that we use for inspiration. Bakit? Because during normal quiet breathing, we do not use any muscle for expiration. Again, remember that. During normal quiet breathing or normal resting respiration, we do not use any muscle for expiration. Ang ginagamit lang natin na muscle is those muscles that we use to inhale. Oh, mamaya explain natin why don't we need any muscle for expiration during normal resting respiration. Okay, so what are those muscles? For inspiration. Okay, yun ang kuhanin muna natin yung mga principal muscles for inspiration. So we have two principal muscles for inspiration. Ano yun? You have your diaphragm and your external intercostals. The diaphragm and external intercostals. The diaphragm, is the flat skeletal muscles located at the base of our lungs, while the external intercostals is located in between the ribs. In between the ribs. Okay? Now, so these are the two important muscles, principal muscles for inspiration. While the rest, such as pectoralis minor, the scalene, and your sternocleidomastoid, these are just accessory muscles for inspiration. We only use these muscles on labored breathing. Kapag tayo nahihirapang huminga, katulad ng mga pasyenteng may chronic obstructive pulmonary diseases, at mga mayroong asthma, may mga hika, we tend to use also our sternocleidomastoid, our scalene, and our pectoralis minor. Yes, wait lang, excuse me lang.
Someone.
Okay, sige. Close the door, close the door. Okay, close the door. Okay, now, so again, sternocleidomastoid, scalene, and pectoralis minor are just accessory muscles for respiration. Kaya malalaman mo kapag ang pasyente ay COPD patients, mapapansin mo sa mga may COPD patients, yung kanilang sternocleidomastoid, yung kanilang scalene, medyo malalaki na, kaya lumalaki yung leeg nila, di ba? Kasi madalas nahihirapan silang huminga. At mapapansin mo rin, medyo mataas yung balikat nila, di ba? Again, because of the frequent use of pectoralis minor, for labored breathing. Tayo normally, when we are breathing, normal resting respiration, we are just using the external intercostals so that our ribs will elevate. Kaya lumalaki yung chest wall natin pag nag-i-inhale tayo, di ba? At saka yung ating diaphragm, which descends kapag tayo ay nag-i-inhale. So this is what happens to our chest kapag tayo nag-i-inhale. Pag nag-inhale tayo, take a look at this. Pag nag-inhale tayo, if this is the original size of your thoracic cavity, ayan, bago ka mag-inhale, this is the original size of your thoracic cavity, the broken line. Pagka nag-inhale tayo, ayun, di ba? The size of the thoracic cavity increases, it expands because of the contraction of the principal muscles for normal quiet breathing. It's your external intercostals and your diaphragm. And take a look at what is happening in your diaphragm. Your diaphragm descends, or it flattens. So ang resulta, lumalaki yung volume or yung size of the thoracic cavity. So, ulitin ko, when we inhale, it's only the external intercostals, and your diaphragm that contracts. During quiet breathing. But during labored breathing, yun, ito ngayon yung tatlong muscle pumapasok na. Sternocleidomastoid muscle, your scalene, at saka yung iyong pectoralis minor muscle. Ngayon, sabi natin kanina, when you exhale during expiration, no muscle is needed. Because expiration is just a passive process. And when we say passive process, it is just brought about by the elastic recoil of the thoracic cage and also of the lungs. Kusang magre-recoil ang lungs natin kasi elastic yan. Once you relax after you inhale, it will automatically recoil to its original size and shape. So you do not need any muscle for expiration. Now, when do you need your abdominal muscles at saka internal intercostals? Sabi po dito, it is a muscle for expiration. It is used only for forceful expiration. When you force expiration, yung binilisan mo yung pagbuga ng hangin during expiration, dun mo lang naman mararamdaman na tumitigas yung abdomen mo. Diba? You try doing that. Yung normal na hinga, hindi tumitigas ang abdomen. Pero pag binilisan mo yung pagbuga ng hangin during expiration, you will feel that your abdominal muscles contract. Again, that is needed only during expiration. So that is the mechanics, of our ventilation. You need those muscles, and the mobility of our thoracic cage in order to breathe normally. Okay. So just imagine, kung gaano mahihirapang huminga ang isang pasyente, for example, na polio. Nung araw kasi ang polio matindi nung wala pang vaccines. Okay? When someone is affected by poliomyelitis in the past nung wala pang polio vaccines, not only the muscles of the lower extremities becomes paralyzed, but also the muscles of the ribs, the intercostals, and even the diaphragm becomes paralyzed. So therefore, polio victims in the past suffer from difficulty breathing. They even suffer from respiratory failure. Okay? So, sige, let us continue. Okay. So, as I have said earlier, itong size or volume of the thoracic cavity, changes cyclically during inspiration and expiration. So what did we say? During inspiration, at the start of the inspiration, the broken line represents the original size or volume of the thoracic cavity. But as you inhale, the thorax expands. So therefore, its size or volume increases. And that cyclical changes in the volume of the thoracic cavity in the lungs results also to the cyclic movement of air into and out of the lungs. Yung hangin in the atmosphere, di ba? Na-i-inhale natin when we inspire, na-exhale natin when we expire. Okay? So we will now be discussing yung mechanics of ventilation. Okay? Now, so the mechanics of ventilation actually is best explained by Boyle's law. Yan. Ano ba yung Boyle's law? Itatype ko muna para hindi ako mahirapang magsulat. Yan. Type ko na lang dito. Yan. So, ano ba yung Boyle's law? Kung natatandaan niyo ang inyong junior high physics. What is Boyle's law? Sa junior high physics, when we say Boyle's law, when the volume or size of the container increases, the pressure of the gas inside the container decreases. Kasi nadidecompress siya eh. Diba? Ibig sabihin, pag mas malaki yung size or volume ng container, the gas inside has a lower pressure. Diba? Now, as the size of the container or the volume of the container decreases, syempre, pag lumiliit yung volume ng container, mako-compress yung hangin sa loob or yung gas sa loob. Diba? So therefore, the pressure of the gas increases. So therefore, in simple terms, when we simplify Boyle's law, pressure is inversely proportional to volume or vice versa. Volume is inversely proportional to pressure. Ulitin natin. When the volume or size of the container increases, the pressure of the gas inside that container decreases. But when the volume or the size of the container decreases, therefore it will compress the gas inside, the pressure of that gas increases. Again, that is your Boyle's law. So how will we apply that in our ventilation, in our ventilatory process? You imagine that your lungs or your thoracic cavity is that container. Yung container na yun. You imagine again that yung container na pinag-uusapan is your thoracic cavity. And yung gas is yung air present in the inside the lungs. Di ba kapag tayo humihinga, when we inhale, the volume of the thoracic cavity increases. And when the volume of the thoracic cavity increases, the intrapulmonary or intrapulmonic pressure or the alveolar pressure, pareho lang yan intrapulmonic and alveolar pressure decreases. Okay. So, sundan natin yung paghinga natin. Okay. So, simulan natin na sa dulo ng bawat expiration. At the end of every expiration, subukan yung huminga, inhale, tapos exhale. At the end of every expiration daw, sa dulo ng pag-exhale natin, the alveolar pressure or the intrapulmonary pressure, yung pressure sa loob ng baga natin, is equal to the atmospheric pressure. Ibig sabihin, pantay yung pressure ng hangin sa atmosphere, sa labas. Hangin sa environment natin. That's atmospheric pressure. At saka yung pressure sa loob. At the end of every expiration. Yeah? At the end of every expiration. So therefore, kapag ka ganon, since equal yung alveolar pressure sa atmospheric pressure, there will be no air movement. Because you have to remember, air movements happen only if there is difference in pressures. Di ba? Usually, air moves from higher pressure to lower pressure. And since at the end of every expiration natin, sa dulo ng bawat pag-exhale natin, equal ang alveolar at atmospheric pressure, there will be no movement for that brief period of time. But as you begin to inhale, tingnan nyo itong number 2. As you begin to inhale, take a look at the direction of the arrows for the ribs. And take a look at the direction of the arrow for the diaphragm. What happens now? The volume of the thorax increases, meaning the size or the volume of the thorax increases. So therefore, that increased thoracic volume, or Boyle's law, when the thoracic volume increases, what happens to the pressure inside or the alveolar pressure? The alveolar pressure decreases. The alveolar pressure decreases during inspiration. And if it decreases, it becomes lower than the atmospheric pressure. So therefore, air will move from outside to inside. Okay, kasi di ba? Air will move from higher to lower pressure. Eh, di ba during inspiration nga, air pressure or the intraalveolar pressure or the intrapulmonary pressure is less than the atmospheric pressure. So therefore, air will move inside. Ngayon, at the end of that inspiration, di ba? At the end of that inspiration, syempre may limit lang ang inspiration eh, di ba? Dadating yung time na hanggang doon na lang sa limit ng pag-expand ng lungs natin, eh di titigil na yung movement. Titigil na yung expansion ng lungs, di ba? Titigil na yung expansion ng thorax. Therefore, when that expansion stops, alveolar pressure will again be equal to the atmospheric pressure. So may dalawang periods pala sa ventilation natin na yung alveolar pressure nagiging equal sa atmospheric pressure. Parehong at the end. Yung isa at the end of inspiration. Itong isa naman is at the end of inspiration. So therefore, there will be no movement of air yet for that brief period of time. But as you begin to exhale during expiration, itong number 4 na tayo. Take a look at the direction of the arrow. Okay? Yung direction of the arrow tells us that the thorax and the lungs is already recoiling to its original shape. Lumiliit na siya ulit. Thereby decreasing the volume or size of the thoracic cavity. Ano mangyayari pag nag-decrease ang volume? The pressure or the alveolar pressure increases. Since the alveolar pressure now is greater than the atmospheric pressure, air will now move out. Ganun kasimple lang ang ventilation natin. So you take note of that mechanics of breathing or our mechanics of ventilation.